Good afternoon. I'm Beth Pike with the State Historical Society of Missouri, and I hope all of you are staying safe and being careful as we navigate our lives through the COVID-19 pandemic. And here we are 100 years later, revisiting a different pandemic today, but one that was very deadly, just the same. In the next hour, we're going to learn how Missouri was affected by the 1918 flu pandemic. There is much to share on this topic, so we have divided it into two parts. Today, Kathleen Seale, our senior archivist at the Rolla Research Center, will talk about how the flu pandemic affected Missouri and its people 100 years ago. And in part one, Katie will guide us all over the state of Missouri to see how our state did during this crisis. Then in part two, which is set for June 25th, Katie will hone in on how various organizations responded to the 1918 flu pandemic. Also, if you are a member of the State Historical Society of Missouri, thank you so much for supporting us. Your annual membership helps us continue programs like we have for you today. And if you're not a member, well, or it's time to renew, we do invite you to join our society online at SHSMO.org. Now it's time to jump back 100 years ago. Much like today, Missouri and the rest of the world was fighting a deadly virus. Welcome to the program, Katie. Your family has been in Southwest Missouri for 8 generations, so no doubt you had Missouri ancestors who dealt with many hardships, including the 1918 flu pandemic.
Hi, Beth. Yeah, thanks for that. So today we're going to be talking about the 1918 flu that happened. I'm going to be focusing mostly on what it looked like here in Missouri. So what did Missourians face here in the state, and then kind of a little bit outside of it as well? What did we experience here? And as Beth said, I had family here in that area, nobody that I know of at this point who died from the flu, but I imagine that there are many of you out there, whether you're from Missouri or not, that maybe have relatives or family members that did experience this. I'm just going to take one quick point right here. Beth was calling it the 1918 flu pandemic, which is the accurate term because it was worldwide. Here, I've labeled it as an epidemic because that's in the historical record. That's how you see it mentioned. They weren't quite using the terminology of the idea of the pandemic, of this global worldwide disease spreading. So that's why you're going to see the word epidemic, which is just a severe case of a disease that's spreading, rather than pandemic, which means worldwide. Okay, we've got a lot of information to get through, so I'm gonna go ahead and get started. And first off, I want to actually look a little bit before the outbreak in 1918 to see what does the influenza seasons prior to 1918 look like? What did people know about the flu? How did they know how it spread? What were some of the preventions and treatments that were common during this time period? So looking here at some of the newspaper articles that we have from the time period, you can see different articles remarking on the flu from 1918 or 1915, 1916. What really struck me in these particular articles, why I chose them, here we talk about the 1915 flu epidemic with the death rate being 16 per 100,000, which is pretty high, and they were remarking on that. So flu season is something that they knew was deadly. They knew that it spread very quickly, and it was something that they kept track of. So it wasn't like they were just surprised by the flu coming, and they were realizing that in the years kind of leading up to 1918, they were seeing more deaths because of that. This could be a number of reasons. It could be more virulent strains of it. Perhaps there was just more reporting, more accurate and more consistent reporting of cases of the flu, and also deaths because of the flu. It's hard to tell with the data that we have. You can also see here talking about the flu in 1916, how the influenza is spreading across the United States. Is the worst they've ever known. So they're remarking on these, and it's really interesting to compare these years leading up to 1918 to what actually happens in that year, because it is so drastically more severe. But they were already remarking in the years before of how bad this is getting. They were going so far as to fine people for spitting. So this, I actually found articles on this kind of across the board. This one just happens to be reporting on people in New York. So they knew that the flu was spread through water molecules of when you cough and when you sneeze. I'm gonna say water molecules because like spit and stuff, that's just gross. So here they actually fined 500 people in one day for spitting, which, wow. The fact that there are that many people, I mean, it's New York, it's a big city. However, 500, come on guys, that's gross. Okay, so what's some of the knowledge and some of the preventative measures and treatments that we see during this time period? You'll see a lot of mentions of influenza and la grippe. I'm not 100% sure on that pronunciation, but for me, that's how I'm going to pronounce it. So la grippe was quite often used as a general terminology when they were talking about pretty much any kind of upper respiratory disease. I see it used in cases for both, for colds, coughs, and then also influenza as well. This particular article here, we talk about AK tablets. So this is one of the treatments offered during this time period. This was actually through the Anti-Camnia pharmaceutical company, which was based in St. Louis. So this particular company had been running for many years. One of the chemicals that they used was it was used for pain relief and fever reduction. So they're really just treating the symptoms of what you would have with the flu or colds or any type of these upper respiratory diseases. The problem with this particular chemical that they use is that it was very easy for people to overdose on, and a lot of people were sensitive to the drug. So they'd have some sort of negative reactions to it. And it was actually taken out of medical use in the 1970s because it was deemed too dangerous. However, they used it during all of those decades prior. You have other remedies such as Dr. Zwart's. Here you can see Humphrey 77. So I found this article interesting because they actually have a list of 8 keep well or preventative measures that you can actually do. So things like keeping out of large crowds, sleeping in a room with a window open, having a ventilated office, walking a mile in the fresh air, covering up your cough and sneezes with your pocket handkerchief, don't spit on the sidewalk. So you have some of those preventative measures that we still use today. If you have the flu, if you have a cough, cover it up. I don't know many people that carry pocket handkerchiefs. I do know some though. So you still have those ideas, staying out of large crowds, limit your exposure to other people who might have it, or if you have it, keep yourself from spreading. But you still have this older way of thinking, things like it's the bad air around you that's causing disease. So you have to get fresh air in, which it's not a bad idea to go out and get some fresh air, but that's not what's going to lead to diseases. The idea of walking a mile, it's good to have exercise, good cardio, but again, it's not what's spreading the flu, and spitting on the sidewalk. So again, that saliva, that water molecules are coming out. Of course, then there's the last one, don't overeat. That feels a little judgmental and pointed towards me, so I'm just gonna skip that one and pretend like that one didn't happen. Okay, so this is kind of some of what we're seeing leading up to 1918. So do people understand what the flu is? Does the general public know? You can see here in an article, so this was actually written by a doctor from the School of Medicine at the University of Missouri, there in Columbia. So he has actually taken this full article to explain the difference between la grippe, what people are using it in a more general term and saying it doesn't mean cold. It's when people are saying that in the severe cases, what they're really meaning is influenza. And then he goes on to say that, you know, it's caused by a specific germ. We know now that it's actually a virus and a viral infection rather than germs or bacteria, but we're starting to get closer to what the flu actually is and an understanding of where it comes from and how it develops. He's also giving out all this really great information about it's a dangerous disease. It can be followed by things like pneumonia, meningitis, severe intestinal symptoms. These are symptoms that you see crop up in the 1918 flu. You can see it in any flu epidemic, but those are some really severe after effects and secondary infections that you see with the 1918 flu. And he's saying that there's no no patent medicine that's actually going to cure it, which is also true. Virus just has to run its course. All they can do is aid with symptoms, that sort of thing. So you can see that this information is out there. The public has it. This is published right there in the newspaper for people to read and learn and know about. So this is what, this is kind of setting the stage and what it's looked like as we get into the 1918 flu. It really starts in spring of 1918. Most of the cases and the most severe and the larger numbers that we see are definitely in the fall. However, there are certainly cases of it in March. And it's from all the medical texts and everything that I was reading, it's believed to be the same strain, or at least a similar enough strain to be connected as one. So, and how we know that we see this spike in cases for the flu in March is by some of the different documents of more contained groups. So this is actually a physician's report that I found for the Missouri State Penitentiary. And they actually, the physician remarked that they had over 500 cases just for the flu and pneumonia related issues in March alone, which I found really interesting because you don't see it in a lot of civilian populations. It's kind of scattered and dispersed. It does happen, but for the spring, you really see it in large concentrations in places like military and training camps, which I'll get to in a minute. But you do see it in civilian populations. You see it here in civilian incarcerated capacity here, which is really interesting because you have this very contained population that you get a much better view of kind of how it spread and what it looked like in these groups. I also have here a death certificate of a 38-year-old gentleman. So you're seeing here those classic signs of this 1918 flu pandemic. Of it strikes and it tends to be more severe and more likely to kill these individuals between the ages of 20 and 40. So this gentleman was a 38-year-old. He was also working for the railroad, so you have a lot of exposure there from different people coming in and out. He may have been traveling along the lines. And if you look at his cause of death, it actually says lobar pneumonia. I did have a nurse read that for me from the doctor's script, just to make sure I was reading that correctly. So lobar pneumonia was a very common secondary infection that you saw in cases of the 1918 influenza. In particular, you saw a lot of the deaths that occur due to it here in March were because of a secondary infection such as this lobar pneumonia. But if you look down to the contributory disease or cause of death, they also label la grippe. So that's something very common that if you look at any of the death records from this time period, you can see those different causes of death. You're gonna see influenza, you're gonna see la grippe, you're gonna see pneumonia, especially in these early cases. You don't see people starting putting down things like the Spanish flu until later towards the fall. Okay. So where the outbreak starts, from all of the medical histories and medical information that I have been looking at, all of them pretty much agree that it's Camp Funston in Kansas. So why Camp Funston? It was the largest training facility built during World War I for the United States Army, connected to Fort Riley. You have a massive number of young men being shipped in, trained, and then shipped out. There's a lot of overlap within these populations. They're all living in close quarters. They're all gathering and living and working in close quarters, kind of on top of each other this whole time period. Also, we know now that the flu can be carried by swine and also birds. So Camp Funston, any of the soldiers being shipped in by train went through Kansas City. And that's where you have the largest hog feedlot for the state of Kansas, is just there outside of Kansas City. Also Camp Funston, there are a number of counties surrounding it as well that are large hog producers. Also, you don't have refrigerated cars at this time. So any pork or poultry that's being shipped in is going to be shipped in live and butchered on site. You just have a lot of, it's just a ripe location, that perfect storm of being able to contract and then also spread the disease as well. It just kind of, from the beginning, training camps, military camps of any kind have been well known to be hot spots for communicable diseases such as the flu, such as measles, smallpox. And the Army actually has many, quarantine measures in place. They've had those in place for years. So they've got the facilities and they've got the abilities to be able to quarantine, which actually probably helped lessen the spread of some of these communicable diseases considerably. You also have professional doctors and nurses and other medical professionals on staff to be able to care for these individuals, ensuring that they get probably better care than what you see across civilian populations during this pandemic. You can see here, there's a letter here at the bottom where they're talking about they're still in quarantine. So this young gentleman wanted to send a package to his girl back home, but was able to do so because they were being quarantined for measles. So this was actually earlier in the year in 1918. I believe it was in January or February. So they've already got the quarantine measures in place. However, with the flu, it struck so fast and it moved so rapidly that sometimes even the strict quarantine measures that the Army had in place weren't enough. For instance, they have a photograph here of John Dykeman. So he was enlisted in the Army in February, and on March 4th, he was shipped to Fort Riley, where he was to train. But by March 24th, he had contracted and come down ill and died from influenza. So in a matter of just 20 days. And, I imagine he was there for a little while getting all set up and everything before he came down from it. It's just, the thing that really struck them was how fast this disease moved, how quickly people came down with it. And also you were looking at a group of young, healthy individuals here that, okay, yeah, he's got the flu, put him on bed rest for a few days, he's going to recover, it's going to be fine. But they weren't finding that the case, especially in some of these early cases that you see at Camp Funston. A lot of them ended up, because of this flu and the severity of it in this particular strain, there was a lot of damage done to the bronchial tree within the lungs, which left them open and very susceptible to developing secondary infections such as pneumonia. And overwhelmingly, especially here in March, that's actually what killed these soldiers, was that secondary infection of pneumonia. They were so weakened by the flu, they weren't able to fight off the pneumonia, and it caused a number of deaths at that time. So another way that the flu outbreak affects Missourians kind of early on is even overseas. So our allies overseas were in need, in kind of some desperate need for medical professionals to assist with wounded soldiers. So out of St. Louis, you have a group organized by the Red Cross and mostly staffed by teachers and graduates, fourth year students from Washington University, the medical college there. So this was actually set up in 1916 and they shipped out in 1917. So they were already set up in France during this time. And at that time, they were just seeing mostly wounded British soldiers that they would stabilize and then move to other locations for rehabilitation and that sort of thing. And then the flu strikes in 1918. You can see here's a letter from one of those medical students out of Washington University, Bert Ball, and he's talking about their experience there in France and the influx of influenza cases that they're seeing. The thing that was different with the influenza patients is when they came in, they either recovered or passed away there at base hospital number 21, simply because they didn't want to risk shipping them elsewhere and possibly infecting other people along the route. So their mission there and how they worked there at the hospital changed significantly with this. I do want to mention this photograph that we have here. This is actually Dr. Eugene Opie. So he was Dean of Pathology at Washington University. He joined the United States Medical Corps, and he's kind of the reason that we know why and how it broke out in Camp Funston. So he was actually looking at secondary infections like pneumonia following cases of measles and the flu, which ultimately led him to Camp Funston in March of 1918, where he starts remarking on the number of soldiers dying from pneumonia. And he actually put forward a lot of suggestions, not so much to quarantine. First step is to quarantine the influenza patients from the rest of the patients. But once you get those influenza patients together, quite often those beds are only a few feet apart. They tried switching soldiers so they were feet to head to try and lessen their exposure from one another. But if you get someone in there with pneumonia, the likelihood of that then spreading to these other sick soldiers was high. So he wanted to see even more quarantining, separating of patients out in a more individual basics. But if you're talking thousands of patients in one ward, the ability to do that is just very limited. Okay, something else going on with World War I, which brings into account, why is it called the Spanish flu? So in May of 1918, the United States passes the Sedition Act. So what this calls for is that no one can willfully utter, print, write, or publish any disloyal, profane, scurrilous, or abusive language. Scurrilous, it's a word we don't use nearly often enough. You also can't agitate against the production of any necessary war materials. One of those war materials is soldiers. If you start seeing headline news across the board of an outbreak of influenza at Camp Funston, one of the main training facilities for soldiers in the Midwest, that's where they're going to be sent, that's killing, many patients, maybe you'll wait until, let me wait until that dies down and then I'll enlist. I don't see moms or dads being too gung-ho about letting their sons go off. Like, you want to serve your country, you want to join the military, you don't want to get sick and die at training camp. That's not the purpose of what you're trying to do. So you really don't see those big, there are certainly stories here and there about, such and such and different individuals dying because of the flu at different forts and camps overseas, but you're not going to see the big headline news. And a lot of that is due to the Sedition Act. So places like Spain, who were neutral during the war, the King of Spain actually comes down ill in May. He ends up recovering, but he's very seriously ill, and the newspapers all across the country just explode with all of these stories about the flu. And they're kind of the first and the most prevalent ones across the globe who are actually reporting on it, which makes people think, oh, well, it first broke out in May in Spain, so that must be the epicenter of where it was. But we know from different articles, such as those written by Dr. Opie, is that no, there were actually cases as early as March here in the US at Camp Funston. So now we're moving on into the fall of 1918. So this is where you really see the flu spread and take off. This is where you really start getting the news stories, and it's across everywhere. And it really starts impacting the nation and the world at this point. The first cases in the US seem to have broken out in August in military bases. Boston in particular was very hard hit, and they kind of suffer quite a number of weeks and months from this epidemic. The Midwest, you see it more towards late September, early October, and early October is really where it takes off in some of the cities in Missouri. So here is kind of early October. Some of the, these are front page news stories, what you see in regards to the flu. So this top right-hand one is actually out of a St. Louis newspaper, but it's talking about in the first 8 days of reported cases for Springfield, already 1/7 of the population has the flu. They already have 49 people who have died and 5,000 cases reported at that time. You also see Governor Gardner of Missouri has suggested, so there's no official proclamation, there's no order by the governor, he's just suggesting and putting this on mayors and city and county officials to make the decisions about postponing meetings and doing any sort of closures. Some groups have gone ahead and run with that and made those decisions. So you have the Columbia newspapers here in the left lower hand corner where the University of Missouri is going to be closed. All work is going to cease as of Thursday of that week. You have other places, a small little one you see here in the center where William Daughtry succumbs to influenza. So in other places, this is out of Greenfield in Dade County, Missouri, down in southwest Missouri. That's the only story that even relates to the flu that you see on that entire front page, is you just have an individual who has died of the disease. No other mentions of it spreading, of some of these larger number of cases in other places. It just hasn't affected this city to that drastic level. Then you have places like the city of Calhoun. So they have gone ahead and are canceling all large gatherings, schools are closed, and it's all forbidden within the city limits of Calhoun. You see over here on the right that Joplin is already reporting 300 cases, and they're going to go ahead and start closing stuff down. Sedalia, on the other hand, only has maybe a handful of cases at this point. However, they're going to be proactive and try to prevent any spread into their community or amongst their community by closing things down. Other places like, is it Cameron? Yes, Cameron. So they're guarding against the flu, and they're going to limit public gatherings of 15, but they're not going to close schools. They're not seeing the cases in their community yet, so they're trying to keep the schools open, but limiting other public functions. And then you have places like La Plata. So this one was front and centered. It was framed out right on the front page of the newspaper there, where the mayor has closed down any gatherings, schools, churches, lodges, all of that is going to be stopped in the attempt to prevent any spread in that, in their city of the flu. So if we look a little bit further into the month, so that was the beginning of the month. That was kind of some of the measures that different locations were taking early on. Later on in the month, this is where it's starting to spread, and you start seeing cases in cities like Ash Grove. So this is going to be down in Greene County. You're just outside of Springfield. You kind of expect those large numbers that you see in the larger cities such as Kansas City, St. Louis, Springfield, Joplin. These are some of the, and St. Joseph are some of the bigger cities in the state of Missouri at this time. But I think what some don't always realize is those communities surrounding these larger cities are just as effective sometimes, because there's a lot of movement and interactions between those communities within these larger cities as well. So they're hit as well. The burial permits that you see here on the left, those are out of St. Louis. And as you can see, overwhelmingly, the cause of death for the individuals is either influenza or pneumonia. You also start seeing more publications from places like the U.S. Public Health Service. So they're putting out this bulletin, this health bulletin, giving people more information on the flu, what causes it, how to prevent it, and that sort of thing. You also see how to make flu masks. So that's out of the Red Cross. Some of the documents that I was reading, looking back at the flu masks used during this time, is that they were basically less than useless. You didn't have the use of medical or any sort of like surgical mask like we see today. That just wasn't common or used across the medical field really at this point. So here they're recommending using multi-layered gauze. Quite often people, if they did use gauze at this time period, it was like 1 or 2 layers. They would cover either the mouth or the nose, but not both. So really for this epidemic, they were less than useless because they weren't properly made or utilized. The one that I really found poignant, this middle one, the influenza scare has proved anew how easy it is to command the children to stay in the house in tones that enable them to forget all about it a minute later. I think that's something that anyone with kids can probably, yeah, I can see heads shaking. I can feel it. It's like, yes, yes, that's exactly what we're facing right now. So definitely some similarities. You can have some empathy with the parents at this time period of trying to keep the kids indoors. They're not in school anymore, keeping them occupied. Okay, so now I want to take and do some case studies across Missouri. What does the flu look like in some different communities across the state? I'm not going to be able to get to all of them, but I hope I can get a good look at kind of the different patterns that you see in each of these communities by taking these samples that I have. So first off, I'm going to start with Trenton. So up in northern Missouri, they very early on, so this is in earlier October, they're asking anybody that might be sick to go ahead and quarantine themselves, and actually very sternly saying, if this is not the case, if we start seeing cases spread, then we're going to go ahead and lock down not just Trenton, but the entire county. We're not going to allow movement between urban and rural populations, and we're just going to close it down. And they're also having all the doctors in Trenton to meet up and talk about it. So they're kind of forming their own public health board of individuals of how do we prevent this spread? How do we treat it? How do we make sure our community is safe and healthy? Like many more rural communities across the state of Missouri, they kind of dodged the bullet for those early October cases. So you see those pop up in those larger urban areas where you have a lot of movement, have a lot of people from out of town moving through. You tend to see spread of communicable diseases more readily there. So a lot of these communities were able to stay at home, stay more isolated, and not get affected by that early wave in October. However, come December, you see if a community is going to be hit, it's quite often in that December wave. Almost no community gets passed by in December. There are certainly cases of that. Rolla here in Phelps County is one of those. The flu really never hit Rolla. We had a few illnesses, a few deaths. I think the first death of an actual citizen of Rolla doesn't happen until later in January, I believe. So again, they get hit by that later wave. But by then it's tapered off some. So Trenton then locks down in December. One of the good questions that kind of came up is why do we have this second wave in December? Is it simply because, you know, you have all these closures, everybody staying at home, staying isolated, and then, you know, over time, those restrictions start to lapse, people start going out. Well, what happens in early November of 1918? You have the end of the war in Europe. So who is going to stay inside when we're celebrating the fact that the war has ended, troops are going to be coming home, there are parades, there are large gatherings, people are going to neighboring towns to attend their festivities, to celebrate with family who are located elsewhere. And after that, because of that, it's not just people going outside and resuming their daily normal day-to-day life. They're also having that huge influx of large crowds, people, you know, one on top of each other, that then sees not only the spread into these rural communities, but also large spikes across the board. Here we have Palmyra. So they started getting hit towards mid and later October, and they start closing down. They go ahead and close schools, churches, all of that. Doctors there say that the city has been remarkably free from the disease, contrary to the usual rule of what they're seeing across the country, but they're going to take that proactive and they're going to try and prevent it from getting in there. However, you do still see cases of that, but they were able to close down there in October. And you see a number of cases of the flu. There was certainly a surge in December here in the community. But I wasn't able to find many reported deaths due to the flu. So maybe they were able to keep their numbers down, which meant the doctors in the town weren't overrun by cases, weren't able to give, good medical care. They were watched. No one developed a secondary infection, which was extremely dangerous for this strain of the flu. So St. Louis, St. Louis has really been touted across many cases as being the way to handle an epidemic or a pandemic in a large city. So very early on in October, the very first days of October, you have a concentrated effort of people reporting flu cases to one centralized location. So you have that organization that sees, okay, we're seeing an uptick in these flu cases. We've already heard of cases in other locations across the United States, so we're gonna go ahead and see if we can't track when it arrives here. So that allowed them to start issuing closing orders very early in October. Their orders were kind of all-encompassing. They were very strict and they were enforced. You also had public and health officials who were working together to create these different closure orders and to ensure that they're enforced, to keep the public informed of what was going on. There were health bulletins that were passed out by the Red Cross. They were published in the newspapers. All of this information just giving out to the public of different ways that they can stay healthy and they can prevent it, and kind of giving them information of what was happening on a day-to-day basis. You also saw a very robust response by the Red Cross chapter here in St. Louis. So they start recruiting nurses and training them very early on. So they actually have the needed kind of medical personnel to help treat and care for these influenza patients. So as I mentioned earlier, a lot of those deaths that occur due to this disease is those people that develop a secondary infection. The flu itself very much killed individuals all on its own. However, getting that secondary infection was very grave news. So you have nurses there that are helping to prevent that, helping keeping an eye on you, making sure that if there's that first hint of you developing pneumonia, that can be treated and taken care of. Just having that added assistance, that second pair of hands and eyes, as opposed to just a single doctor who might be helping an entire community, really helped the death rate numbers here in St. Louis stay low. So you can see here the death rate is 380 people per 100,000. If we think back to that 1915 number where they said 16 in 100,000, and they were astonished by that number and thought that was incredibly high, worth remarking on. And here we're up to 380. An estimated 2,900 people died in that October, November. So they actually kept those numbers down through October, November. However, as with other locations, early November, everybody's out celebrating the end of the war. St. Louis, the restrictions and closures start lifting. People are outside celebrating the end of the war. And you see that large spike of cases happen in December. So you can see here on this newspaper article that on December 1st, like, we're gonna go ahead, all Christmas functions, we're gonna be closed for the next round of this flu. We're gonna go ahead and close everything through December, which helped keep numbers down, but it had kind of gotten out of hand by the time that they were able to do this already. Other places, so across the state, looking here at Kansas City, not as well organized. You didn't have that concerted effort between health and city officials. Even amongst city officials or health officials themselves, there was a lot of contradicting each other. Nobody was coming together to say, this is what we're gonna do, this is what's gonna happen. So especially early on, it gets out of hand very quickly, and you see places closing down schools and churches and different gatherings, but it's kind of lax in being enforced. I have here a picture of the Sweeney School. So this was actually a motoring mechanic school training mechanics, and the United States Army used this to train their mechanics for World War I. They actually had a case break out in early October where a few of their of the young men there came down ill. It's believed to have been, there were a few young ladies who came to visit, probably do a little flirting with some of the young men there. Those ladies ended up ill. A day later, these same individuals, these same gentlemen end up ill as well. And it spreads like wildfire through the school. By the end of the day, I believe it's by the end of the day, you have about 100 cases, and then close to 500 cases within 48 hours. Nearly the entire school ends up ill with the flu, and the Army completely quarantines and shuts down, quarantines the school, nobody in or out, more to protect their mechanics and students inside the school rather than the rest of the population. You also have different businesses that fail to report cases of flu at their locations. So hotels weren't letting the health officials know that, hey, yeah, we had a case of the flu break out here because they thought it would hurt business, which just led to more cases occurring there at their locations. So the death rate in Kansas City for that fall is 781 per 100,000. So over twice the amount of what you see in St. Louis, a similarly sized city at that time period. In other parts of the state, so down here in Cape Girardeau, they have a few cases in October, but they really get hit by that second wave, that second surge there in December. So in October, there's some closures, there's recommendations for how to prevent it, avoiding large crowds. They recommend people postpone things. Schools are still in session for the most part, but in December, you see here that the lid gets clamped down. Within a few days here, we have 120 new cases. In those couple of days, you also have some higher ranking officials in the city who come down ill, and now we're going to close the city down for the month of December to try and stop the spread through the community. We talked a little bit about Springfield earlier. So they had 5 local deaths by October 9th. By the 11th, they had 20 deaths. And then on October 12th, they had 10 more deaths. So they really get hit again by that early wave of the flu in October. So they start doing the closures as well, just like larger cities such as St. Louis and stuff. So they do that very early on. You have Red Cross here, mostly for rehabbing soldiers, but they're out in the community. You also have larger health facilities here available for the city, and then also some of those surrounding communities that are kind of being affected by what's going on in Springfield. One of the kind of businesses that was very much affected by the flu, especially in Springfield, is actually those who were employed by the Frisco, so the St. Louis San Francisco Railroad. So again, you have a number of them who are traveling up and down the line. They're going to some of these larger epicenters of the disease, such as St. Louis, and then traveling back home, but they're also working with freight and passengers on a regular basis. So the Frisco employees were hit particularly hard during this time period. So, it's a very brief look at some of these different communities, but you can kind of see the trend of what they were. So typically those larger communities where you have a lot of connections with other locations across the state, across the country, such as Kansas City, St. Louis, Springfield, very large railroad terminal stations. You have a lot of movement in and out of people from out of town, from out of state, moving through there. You see that surge in October. You see closures that are able to lessen the number of cases and deaths you see, and everybody starts tapering off towards the end of October into that early November, but mid-November into December, you see the spike. If some of those rural isolated counties didn't see that spike in October, because you have to think of what did life look like in 1918 if you were in a rural county town in Missouri. you don't go to town on a regular basis. You don't need to. A lot of what you can find, what you need is within your own community. So I'm from Southwest Missouri, from Dade County, in my little town there. It's, you know, just over 200 people now. But at the turn of the century, there were thousands of people there. There was a working mine just outside of town. There were something like 10 general stores. There was a livery, blacksmith, milliner shop. You could find everything you needed locally. You didn't have to go all the way into town like we do today. You don't have that commuter society where you have a lot of movement between smaller towns and these larger urban centers like we do now. Something else to take into consideration is during this time period, the population for the United States was moving into more urban areas. So by 1920, more people in the United States lived in an urban center than in a rural setting. So that was still happening during that 1918, which is why we see some of those spikes in those larger populations. You have a lot of these rural communities that just don't have the level of exposure to communicable diseases. You'll see a run of measles run through the small town every few years. In larger cities, that happens on a regular basis, which means there are immunities there's built up. You don't have it in these smaller communities. So those from those rural background may not be able to fight off the diseases as well, which is one of the speculations of why it hit so well at Army camps. Is you have a lot of people from very diverse backgrounds coming into this one small little space and all living on top of each other, you know, sharing germs along the way. As far as Missouri goes, so in 1918, Missouri was the 7th largest state by population, but out of the 30 states that have the information available, some of the other states just didn't have the reporting available to be able to include them in these statistics. Missouri's death rate was actually the 22nd out of all of those 30s, even though we were the 7th largest state at that time. You saw those higher number of cases and deaths in those large cities such as Kansas City, St. Louis, Springfield, Joplin, St. Joe, which is what you expect in those larger metropolis areas. People are on top of each other. You can't separate to the degree you can if you live on a farm in the middle of 40 acres with just your family. It's a lot easier to do that there than if you're in an apartment where you're literally stacked on top of each other and you have to pass someone in the hallway every day. The places outside of, so if we kind of exempt Jackson and St. Louis counties, simply because their populations are so much larger, they can skew the results here. The southeastern Missouri saw the highest death rate for the Spanish flu. You also have to take into consideration here, this is some of your more rural and some of the poorest regions of the state at this time period. You don't have a doctor for every patient. Here we have an example of Van Buren. There's only 2 doctors in town and they're taking care of the entire town and probably some of the surrounding countryside as well, and they're just being run ragged. So any care, you know, they might be seen by the doctor and they may not see the doctor again for many days or weeks. Any care they receive is going to be from family members who may or may not know what they're doing or how to take care of a sick person, and what happens if they come down sick with the flu as well. This particular strain of the flu was so virulent, it laid people out. You were bedridden, you were suffering from high fevers. Some people, especially in those younger categories, their immune system almost overreacted to the disease and they had these extreme high fevers and they were hemorrhaging. So they were bleeding out of their eyes and nose. I know it's a little graphic, I'm sorry. But it's an extremely scary disease. Can you imagine if you're, you know, a younger kid, a teenager, and your parents both come down ill and you're trying to care for them? So it's just a very different look across different communities of how this affected people and how people were able to react to it. So 12.4 out of every 1,000 Missourians died from this. Those with the highest mortality rates, the counties, again, this is outside of Jackson and St. Louis, are Dunklin, Vernon, and Butler counties. So some of those counties that just were harder hit, weren't able to get medical care. It's not real clear. because the lowest death rates across the state were in Dallas, Douglas, and McDonald County. So they just didn't have the number of cases as some of these other locations. And as I mentioned, some of those rural counties were hit later with that second wave in November and December. So this chart just shows you a little bit of the different regions across the state and how the mortality rates changed. Here they have it between 1915 and 1918. So what that looks like, and you see that kind of big spike in southeast Missouri of what it was. This epidemic, it was very severe, it was virulent, and it left people open to those secondary infections, which were just catastrophic to a great portion of the population. So putting Missouri a little bit more into the world view, across at least 50 million people worldwide died from the flu, from this particular strain. Everything that I have come across, all the medical histories and the research done, they all agree with that 50 million number plus. They believe it's over that. However, as you saw, we only had 30 states across the United States reporting in on their numbers. So if we have states here in the US who aren't able to contribute accurate numbers, imagine worldwide being able to get accurate accountings for all of these deaths, especially in the midst of a world war. There's some locations where you simply don't have record keeping at this time period. Put that in a little perspective, 15 million people were killed during World War I, as opposed to the 50 million due to the flu. In the United States alone, 675,000 in the US died from it. In October, they were, stating if we get through this with only 100,000 deaths, that's going to be a miracle. Unfortunately, that wasn't the case. In October alone, over 195,000 Americans died just in that first wave, because it was so severe and it moved so quickly from people catching it to falling severely ill and then dying from it. It was so fast. As I mentioned earlier, that 20 to 40 age range was the most common victims, which was not common for the flu. Usually you see it, deaths occur in the very young or the very old, simply because they don't have the immune system to fight it off. This particular strain of the flu, it seemed to cause an overreaction in those with healthy immune systems, which caused more damage to their body, caused damage to the lung, left them open to secondary infections. Also, there's some speculation and some research looking at people who went through the 1889 flu epidemic. There's some looking at that see some similarities between 1918 and the 1889 strain of the flu. So those that survived 1889 maybe had some immunities. So even if they caught the 1918 flu, they were more likely to survive it. So that puts you at that 40 and above age range. Across the board, a fourth of all Americans experience symptoms of the flu. So that doesn't take into account those that were just carriers and never had symptoms. And so many Americans died that it actually lowered the life expectancy by 12 years. I think that's the one that kind of blows my mind, 12 years off total average life expectancy for Americans. And then even those who did survive, there were those who developed health complications in later year. There was, damage to kidneys, to your lungs, which made you susceptible to later diseases or infections there. There's one called the von Economo disease. I don't know if I'm saying that right. But it was a Parkinson-like illness that just caused uncontrollable tremors and shakes. So even surviving it, you still had some of these side effects. So overall, just a truly devastating experience for Missouri, for the country. But I hope through this that maybe you got a little bit more information of what it looked like for some of our ancestors and some of the people who lived here in Missouri, because as we're finding today during the midst of the coronavirus, everybody is experiencing this, but we're all experiencing it in different ways. And I think that's important to remember and recognize is it's a little bit different for all of us. And it's important to know that.
Thanks so much, Katie. That was really interesting. A lot of information. I could see why we're going to do it in 2 parts.
Yeah.
For certain. So while we still have everyone with us, we are going to go extend a little bit past to answer a few more questions. If you're okay with that, Katie.
Yes, absolutely.
So we'll try to get a few of these in here in the next 10 or 15 minutes before we do sign off. But one of the persons was asking about their own records. They don't really have death records of family members other than heard that family member had died possibly of the flu, but doesn't know if it was of the Spanish flu. How does someone look into records from their own family to determine that?
Yeah, that's a really great question. So starting with the State Historical Society and what records we might have, I would definitely look for newspaper articles from either their hometown or neighboring towns, larger communities that had were publishing newspapers, because especially as the Spanish flu starts taking off, those are stories that newspapers are reporting. So even if it's not a full obituary, there's quite often a notice of saying so-and-so has passed because of this, even if they weren't here in Missouri. I found a lot of people reporting on someone who used to live here in Rolla and is now elsewhere, but they have passed from that. Also, the Missouri State Archives has available online digitally Missouri death records from this time period. So if they died here in Missouri, you can find their death certificate. And as I showed on a previous slide, it's going to have that cause of death over there on the right generally. So you're going to find stuff like flu, Spanish flu, low grip, pneumonia as cause of death, and you can find out what that was. Other states are going to have different time frames for records. Some places have them available online. Other places you have to talk to the either county or usually the state's kind of health services asking for a death certificate.
Great. Charles asked, was Jefferson Barracks involved to a significant extent with the Spanish flu?
Yeah, so you saw they had a slight outbreak in March. It wasn't to any real large degree, but they certainly got hit with that second wave. You see mentions of that in a lot of St. Louis newspapers of Jefferson Barracks being hit. But again, you have the Sedition Act going on, so it's not going to be, big headline news. It's just going to be more of X number of soldiers have come down ill with the flu this week, or references to different soldiers who have possibly died there. But yeah, they definitely got hit in that second wave in the fall of 1918.
And Jason was wondering if we had any access to personal journals or correspondence related to the 1918 flu. And if so, he would like to know where we could find those on our website. Jason's a high school teacher, and so that would be something possibly he could incorporate into
Yeah, absolutely. So I'm just going to answer this kind of generally, but if you want to get in contact with me personally, I can hopefully send you some links directly to that. My contact information is right there. You can also reach out to our research at shsmo.org email, and we can forward that on and get you that. So talking about that, if you're looking for personal accountings of the flu, the really great thing, even though it's horrible that we're having World War I at that time period, you had a lot of people who were writing letters. You had a lot of people who were journaling, and a lot of these were kept. These were seen as important materials and information for family members, because they were, soldiers who fought during this time, or they were family members writing to soldiers at different camps. So I would really start with our World War I material. We have a research guide on our website that you can find. We also have a digital collection for World War I materials. So all of that's available online. We have many, many, many more resources available in our physical collections, which are a little hard to get to right now as we're kind of transitioning to being back in the office. But for right now, there are materials available online. And again, start with that World War I stuff, because it's all of that time period. And there was always information in there of, letters written to soldiers with information from back home. Oh, hey, did you know so-and-so has sick? So it's not just the military life. And that's probably the best place to start at this time. And I know there's quite a bit of it available in our digital collections that are
and it's word searchable. So if someone would type in the words, they'll be able to see.
Yes, it'll be able to pop up. And I would recommend on that trying different search terms. So Spanish flu, influenza, la grippe, quarantine, just try different search terms, because each soldier is going to use different terminology for talking about it.
Absolutely. And again, this video is going to be published so people can, particularly for school children, this would be a program they could also watch as well. So that will be on our website. Don't know exactly when, but look for it. We will be publishing all of these webinars that we're doing. So, so let's see, I have on here from Lynn, my aunt died at age 17 on a farm near Columbia. The death certificate states that she caught the influenza from her 16-year-old sister, and she's curious about how widespread the flu was in Columbia and how it affected the university, which I know you're going to be going into on the next part 2, but if you want to quickly address that.
That's wild that they were that specific. Yeah, caught it from her sister. Like, that's just harsh a little bit there. Yeah, it was a little bit, you see concentrations around areas that have medical facilities. It's just going to happen. And Columbia is one of those that you have the medical school there, you have the hospital during that time period. So it was definitely prevalent, and I saw many cases of that. In part 2, I'm going to be talking a little bit about how different entities and institutions, including universities, responded to the flu in a little bit more detailed. So I'll get into that later. But yeah, Columbia was another one of those that was hard hit early on. Again, saw the drop and then saw the surge again in December. It wasn't nearly the number of cases simply because they didn't have the population at that time, as you see in other places like Springfield. However, they were a harder hit community as well.
Peggy asked, do we know anything about incidents among African Americans in Missouri in 1918, and were statistics kept by race?
So there were some studies, and actually that doctor that I mentioned, Dr. Eugene Opie, if you're looking at, he really focused on some of his research because he was trying to figure out how these cases spread and what some of the causations of that were. So he actually focused on race as one of his criteria, which was really fascinating. He looked at rural versus urban soldiers being sent, and was that a cause? Was it socioeconomic? So he was actually looking at some of these African-American soldiers that were being trained at Camp Funston that were coming down with the flu and then pneumonia. And what he found was those most likely to come down ill and then possibly die from the disease were actually African-Americans that were being shipped up from Mississippi and Louisiana. So these were individuals for much more rural communities, not so much the fact that it was, African-American versus white populations, what the differences were there. It was more those from those very rural communities. And also, this may be the first time some of those individuals had ever been outside of Mississippi or Louisiana, and now you're throwing them into a batch of Midwest soldiers, more disease communication there, and you don't have the same immunities or antibodies built up. There's also some studies done in St. Louis in regards to the different ethnicities and race there. So they looked at, and I know there's a really great article in the Missouri Historical Review focusing on St. Louis, where they looked at like the German population and the African-American population and different communities across St. Louis. And what they found was it really kind of everybody was more susceptible to catching it, but some of these populations, the African-American population, especially in some of the sections of St. Louis, tended to be poor communities. They didn't have ready access to health facilities, so they were more likely to catch secondary infections and die from it, but they weren't catching the flu any more so than any other ethnic background in St. Louis. So there are some studies that look at that. There's some people, a lot of them are taking those death records that you can find from the Missouri State Archives, because it will give you all of that information of ethnicity and race and then the cause of death. So that's kind of there are some studies out there, and they're really interesting to look at, because they're not, it seems to be more of the healthcare and whether their community was really affected by that first wave. So they're not finding these communities to be any more likely to get the influenza, but those that lack either the immunities and the antibodies and be able to fight it off, or access to healthcare, tends to be those that are more likely to get a secondary infection and become really sick or die from it. Yeah.
Dwayne asked, was the higher rate of mortality in southern Missouri at all influenced by religious gatherings?
You know, none of that. That's a really great question. I know there were a lot of cities, you saw a lot of locations, they tended to cancel church before they would school, is what I kind of found in some of those proclamations across the board. So I don't know, you know, you may not be having church services, but there's still going to be some, you know, different religious gatherings, picnics, that sort of thing occurring. But there's no way to really tell from the information and the data that's there. I think a lot of it is the actual spread of the disease could be from these gatherings you're seeing, but the mortality rate, I think, is really due to those rural populations not having immunities, the overreaction of those young immune systems, and then lack of healthcare. Because there were entire family groups that died because of this. I know recently read an article about Midco, Missouri, here in mid-Missouri. This, you know, an entire family came down with the flu, so there's no one within the family unit to care for anybody there, and they all ended up dying from this disease. And it really affects kind of those smaller communities that maybe doesn't have a doctor. They use the doctor from the town over who's busy in and of himself. So I don't know that, you know, church gatherings, those seem to be closed down more readily than other types of gatherings, for sure.
So why is it, Elizabeth asked, still referred to Spanish flu, even though that's not where it originated? We still today consider it or call it that.
Yeah, no, that's a really good question, because actually, even though we have this report from Dr. Opie, this was, you know, right there in 1918, he does some publishing in 1920, most of that is within the United States Army Medical Corps. So it kind of stays a little more insular. It's, you know, within those medical military fields that it's known. Whereas all across any newspapers from the time period, it's always referred to as Spanish flu. So that's the name that people remember. People who went through this pandemic, that was the name that was associated with it. That's what their parents called it. That's what their grandparents called it. So that's the name that actually gets passed down. And you actually see it in later historical and even medical text of people referring to it as the Spanish flu. And there was actually quite a bit of speculation of people not knowing where it was originated. I read one, it was written in the 1970s. It had a lot of really good information, but even they were speculating, you know, was it soldiers on shore leave in Spain, or no, it started in army camps in France and then made its way down to Spain. So even though we had that data, a lot of it was not readily available until more recent years, especially with this, you know, the 100-year anniversary of the Spanish flu in 1918. You see a lot more articles and information coming out regarding that and making that a little more widely known. Because I know when I was growing up learning about the flu, it was called the Spanish flu. So yeah, that was a common name that everybody knew. Yeah.
Yes, well, Katie, we're really probably about out of time, but I want to refer people to your email address. There's a few more that went unanswered, so you can write to Katie directly. Thank you so much, Katie. Thank you all for joining us, and we look forward to seeing you next time. Have a good afternoon.